Thank you. I just want to thank the organizers for the invitation. And so the title of my talk today is Integrating Discoveries in Basic Clinical and Population Science to Advance Predictive Cancer Care. And I'll talk a lot about pharmacogenomics. I don't have any financial relationships to disclose working for the government. I will disclose that I am trained as a molecular epidemiologist, so I'm really coming at a different perspective. I'm really looking at these biomarkers and how we can get them into clinic and what evidence is needed, and also the research that's needed to provide that evidence. So I'm really going to give a broad perspective today of what we've seen at NCI, of what's needed to bring some of these biomarkers into practice, and lessons learned from previous markers who are trying to get there or are in the clinic right now. So I'll briefly talk about predictive cancer medicine. Most of you know this very well. Talk about the conceptual model that we've been working off of at NCI. I'll mention a trans-NCI working group in pharmacogenomics and pharmacoepidemiology that we formed a couple of years ago, and some research recommendations that came from this working group, and then give you some examples of some studies that illustrate these research recommendations. So I don't have to tell this group that the number of newly approved oncology drugs has increased dramatically over the last 15 years. A lot of these drugs have been these molecular targeted therapies, and as we all know, these are very expensive. 20 years ago, if you were going to have colorectal cancer treatment, it would cost a few $100s for 6 months, and now we're into the $30,000 and $40,000 range. So we really want to know who these drugs are good for and who they're not good for. Predictive cancer medicine is really tailoring medical cancer prevention and treatment therapies to the individual characteristics of the patient, improving their quality of life and health outcomes. And you've heard this before, it's the right medicine to the right person at the right dosage at the right time. There's a lot of talk about prognostic markers and predictive markers, and I just put up this slide just to illustrate, because it can be confusing. Prognostic markers are generally markers that tell a clinician whether or not they should treat the patient or not treat the patient. It has really nothing to do with treatment. Predictive markers, which we're much more interested in, is something that can direct therapy, what dose, which type of treatment, and just to keep this in mind, many prognostic markers are also predictive markers as well. So in predictive cancer medicine or pharmacogenomics, if we had the same patients with the same cancer diagnosis, we want to know who's going to respond to treatment, who's not going to respond to treatment, and who's going to experience adverse events. And certainly we want to know who's going to be compliant with treatment, especially for oral chemotherapy agents. And the goal, of course, is to maximize response, minimize toxicity, reduce costs, and improve quality of life. So ideally, one day we will get there. I attended a lecture earlier today where you're going to walk into the pharmacist and give him your whole genome sequence, and he'll give you the medications that are fit for your disease and your genomic profile. But we're not quite there yet. So there are several disciplines that contribute to the study of